listening to the Pharmacy Podcast Network.
All right, welcome everyone. We are here for a precepting podcast. Quite the dynamic conversation here today amongst a number of leaders here within APhA and within the overall realm of precepting. So let's get right to it. Yours truly, I am Mark Garofoli. In the big picture, I am within West Virginia University, WVU, School of Pharmacy. I'm the Director of Experiential Learning. And on the clinical side, dabble into pain management and substance use disorder addiction. Some may have heard of the Pain Guy thing. You could certainly check that out, painguy.us. And also I host the Pain Pod on the Pharmacy Podcast Network. So there's a lot of podcasting out there, right? But here today in our overall team, first up, we actually have Dr. Stephanie Arnett. She's currently Director of Student Career Development and Engagement at Purdue University College of Pharmacy. Amongst many things, some of the efforts that she'll dive into include creating and coordinating career development opportunities, supporting students in their career journey, coordinating remedial action needs for students on experiential rotations. A lot, right? Like most. Some of her past experiences include, 15 years of precepting for all levels of learners. It's not just student pharmacists, but residency all along the way. And also she's has 9 years of experience as a residency program director in RPD. So we welcome you, Stephanie, of course. We also have with us Dr. Ryan Ades. He is Director of IPPE and Experiential Curriculum at, again, Purdue University College of Pharmacy. Dr. Ades is a member of the Experiential Learning Advisory Council for Purdue University College of Pharmacy and serves as the co-chair of Legislative and Regulatory Council for the Indiana Pharmacy Association, IPA. He also administrates a grant program for District 4 of the NABP and AACP, focused on driving meaningful, lasting change initiated by student pharmacists. And last but not least, we also have Dr. Meagan Brown. She is a clinical associate professor in the Department of Pharmacy Practice and director of the Center for Clinical and Translational Science, or CCTS, at the University of Mississippi School of Pharmacy in Jackson, Mississippi. She also practices at a federally qualified healthcare center, FQHC, in rural Mississippi, taking care of patients with cardiometabolic disease, also educating students and residents in her practice site. So we've got quite the crew here today, and we really want to dive right into it because turns out you're listening, you're busy too. We want to get to the meat and potatoes here for going over precepting and difficult situations overall. All right, Ryan, to catalyze our conversation here on precepting and interesting situations, what systemic changes do you believe can be implemented to better support preceptors dealing with challenging learners?
Yeah, Mark, that's a good question because these are difficult situations generally. They're things that we don't want any of our preceptors to go through. But when we're faced with a difficult situation or a challenging learner, I feel like a couple things that we can do systemically. First off, just setting and reinforcing clear expectations with both preceptors and students so that the preceptor feels empowered to provide appropriate feedback and knows the next steps and processes when they have a student who is struggling. There have been many times in my previous experiences where a preceptor just didn't feel like they understood the way they were supposed to move forward with a challenging student. So even if you've laid out those expectations, making sure that you refer the preceptor to them and can kind of follow through with those expectations that you've had laid out, I think that's one really key systemic change that you can make. I also think it's really important that you establish some early outreach pathways, both for the preceptor to identify a potentially struggling student, but also for students to kind of self-identify and say, hey, I'm not doing well on this rotation. I need some help. I think if you can set up those pathways and make it clear that these are opportunities to provide the best learning experience and to get the most out of rotations for students, you really have a much more positive opportunity to work with students than something that seems to come from a much more negative light. And then I think one other way that you can work on something in a systemic matter to deal with challenging learners is to make sure that the learners have everything they need to be successful. And I would specifically call out making sure that there's an accommodations process for experiences or for students that might need accommodations as appropriate. We think about accommodations a lot from a classroom's perspective, but we don't always think about them from an experiential learning opportunity. And I do think there's a number of times when accommodations might be appropriate for students to put them in the right frame of mind and to give them the right resources to be successful. So those would be three things from a systemic mindset that I think you could work through.
Ryan, wonderful. It sounds like a lot of planning and preparation, right? So I think that'll take us into a question for everybody here. I'm going to ask you first, just to transition here, but this genre of preparation, how would you say it's best to prepare to have a difficult conversation with a learner? And then I'll ask Meagan and Stephanie as well too. But let's hear what you have to say first.
Sure. So from my perspective, the best thing that you can do to prepare to have a difficult conversation is to have all of your facts straight and laid out in front of you, and then go into that conversation not in an accusatory manner, but in a growth mindset manner. So highlighting the things that are not going well and having an open conversation with the student about what they want to gain out of this experience, what they feel appropriate expectations would be moving forward, and making sure that the preceptor and the student are on the same page with what the student needs to do to be successful.
All right. Having heard those words from Ryan, I'd ask the rest of us here. Meagan, we'll say you next. How do you prepare to have difficult conversations with a learner?
Ryan covered a good bit of it. I definitely think starting with the facts is important. I also like to kind of start with having the student reflect on how they feel their performance went. If you can give them the specific instance or the specific time frame in which you observe the student maybe performing at a less than optimal level, then I think it's best to start there and kind of have them reflect on how they went or how it went. I would hope that the student has some perception and understanding that there are things that could have improved. And so sometimes it's helpful to use their reflection to be the kickstart to opening the conversation for where things have gone wrong. I also think it's really important when you're sitting down to have these conversations that you have the specifics, as Ryan also mentioned, just having the facts straight, and encouraging them by using I statements and stating how you feel, things could move forward with specific feedback for them.
Well, thank you, Meagan. And well, Stephanie, you get the hardest approach here because you're going third, and both Meagan and Ryan have covered a lot, but any additional thoughts?
Yes, they all gave really good answers to that question. And so, I second and third all those pieces. The facts are so important. I think sometimes when we think about the facts, those perceptions from different individuals, whether it's coming from the experiential side, do I need to have a conversation with multiple individuals or preceptors and having multiple perspectives of the situation? Is it coming from the learner's experience on site as the preceptor itself? what other individuals have potentially worked with the student. Again, making sure we get the facts straight, and also the perceptions. I think a lot of times where there's misalignment is there's misalignment in general expectations and really going in with a positive intent. I think most individuals, the majority of the time, there's no malicious intent. And so really thinking about positive intent going into the conversations, truly thinking that, hey, let's clear the air, let's figure out where some of the misalignment's coming from, and then making sure as you're navigating forward that there is a plan going forward and that there's accountability pieces in place to be able to have a clear expectation, a clear plan for both the student and the preceptor.
All right, so let's get into our conversation here with tricky situations overall. They are abundant in experiential education, whether precepting or student pharmacist or resident, any point of view of learner or educator. But first up, we're going to go with you, Meagan. Here's a question for you. How do you adjust your teaching to meet the needs of different levels of learners at the same site? Such as a high-performing learner and a learner who might be struggling?
That's a great question, Mark. And it is not easy. I will start there. I've been in this situation exactly towards the end of the P4 year, having two advanced pharmacy practice experiential students, so two APPE students on rotation. One who had high ambitions, knew what they were going to do, had plans to pursue a PhD post-PharmD. And then I had another student who seemed to struggle a little bit more with knowing exactly where they fit in the pharmacy world, and had some challenges, I believe, in the curriculum prior to that. So I tried to do my best in contacting them. Well, our students contact us 2 weeks before the rotation to get any expectations or outlines that they need prior to coming in. I orient students always, regardless of where I feel they are. There's always an orientation, as we should do as preceptors. But in that pre-email, I made sure to highlight for them that I really wanted them to come in being able to feel confident, because this was the last rotation before graduation, with their drug knowledge around the things that we would see most, which includes, in my clinic, diabetes, hypertension, and dyslipidemia. I even encouraged them that if they were interested in taking a test for not a grade necessarily, but more to give them an opportunity to self-assess where they were, that they could also take the test upon arrival, so that they were able to see how well they were performing as it relates to the disease states that we see most. In doing this, I found that I was able to start kind of with some concrete information for our students to reflect on, and see that, as I expected, my high-performing student did really well on the exam, passed it, or would have considered a passing grade, whereas the student that I kind of expected to struggle did have lower scores. And so we discussed a plan moving forward, and we were able to personalize that, which I think was very helpful to the situation, because while they're at the same site, I'm giving them different assignments based on their initial performance. And so I do think it's good to individualize, but also sticking to kind of the things that you keep standard. So for example, both students were still asked to give a journal club, and both students were still asked to take the final assessment for my rotation. And so I think that was helpful, though, being able to tailor some of the assignments that I gave the student who I thought might struggle a little bit more, by starting it with some evidence as to why I felt that was necessary.
Wonderful information. Thank you, Meagan. And, I'm going to hone in on something you mentioned a couple times there about high-performing learners. So this next one's going to follow up on that here. But how do you respectfully, but we'll say assertively, slow down an overly assertive or confident student while not killing their confidence entirely as well?
That's also a good question, Mark. And I think this is a tougher situation to deal with, because when you have an overly confident student, they don't perceive that there's anything wrong that they're doing, or they may be somewhat right, but maybe could be better and maybe their delivery, or, they've got the first steps right, but what we're really expecting is for them to take that further. And because they've got the first answer right, they don't, they're not thinking past that first answer. So I think it's important to encourage a student who is on the right track and give them positive feedback in the places where they do well. So, for example, I've experienced an overly confident student who was really great with patience. Their tone, their delivery of information, especially working in a setting where we deal with the underserved. So, having to be mindful of the fact that we're dealing with individuals who may have lower understanding and a lower perception of what to do with their disease state, I found that the student did really well with the delivery of information. However, when it came to making therapeutic recommendations, the student really didn't think past just dose increasing, didn't do a great job at recommending new medications or giving the concrete reason for that. And so what I find is helpful is just kind of take them down a path to show them there is still more to learn. So in a you know, if you have the time to further question the student on their recommendation, because again, it may be a right recommendation, but there may be many other options. So asking them, if you didn't do that, what else might you do? Or, can you tell me how that works? Or if that doesn't work when they come back, what might you do then? And see if you can take them down a path to show them that there's still more to learn. I think that that's helpful. I think it's important, though, to convey a tone of learning and understanding and not aggression, because you don't want a student to perceive that you are just quizzing them or putting them on the spot to kind of show that they don't know the next step. And so I think that also starts by defining the culture of, your rotation and what you do. So I like to tell my students that it's like Planet Fitness. We're a judgment-free zone. And we, do our best. And I tell them that I'm going to ask them hard questions because I want to see where their thought processes are and how they are making the decisions that they're coming to. And so I try to re-emphasize that with a student who may be overly confident or overly assertive. And I also try and be mindful of the patient population that we're dealing with. And so I understand that that may vary, but especially in a place where I work in the Mississippi Delta in Yazoo City, Mississippi, which its nickname is called the Gateway to the Delta, which is the Mississippi Delta, a region of Mississippi that's largely underserved and suffers from socioeconomic disparities. And so I think it's really important to also help them understand the tone in which is best received by our patients and to re-emphasize to them that in order to get the best outcomes for our patients, we have to deliver the information in a way that is going to be received.
Meagan, I'm still thinking of the Planet Fitness visualization in my mind here. That's wonderful.
It usually gets a laugh out of them too. So, kind of helps to break the ice.
It's an incredibly important part of education overall. So, all right, I'm going to pivot significantly here. So Stephanie, you're up to bat here next. But this actually is something that hits home, and I'd love to hear another viewpoint on it here. But how do you suggest that a learner would select a different letter writer, recommendation letters for residency applications? In other words, you, me, whoever might not be the best choice due to not having direct precepting role with the student or any organizational or service involvement, so on and so forth. Any thoughts?
Thanks, Mark. Yeah, this is a great question and something that actually has come up for me personally. And I'll wear a couple different hats as answering this question, and also my experience as a residency program director. Although I'm not a current program director, my time as a director, I saw the other side, right? And so I think it's helpful to be able to kind of understand the authenticity that is needed in the letter writing process as we support our learners through a competitive process and achieving those goals that they have for the next steps in their career. I'm really honest. I think it's super important to be honest and authentic with the student. There's no reason to beat around the bush about what reason may or may not exist for you not being able to write a letter for the student. For me personally, my current role, I have a lot of one-on-one conversations with students. I serve as a mentor to many of them. Sometimes it's navigating those career options and really finding that place that's best for them. And through those conversations, we can develop great relationships and trusting relationships where I can work closely with the students as they're really developing down that journey and down that path. However, I may not know some of the characteristics that we really do want to know in our residency applications on, do you show up to work on time? Do you, how well do you manage projects? What is your character in general like, and what is it like to work with you? So I think we have to be really clear and help students navigate what those types of relationships are and the best scenarios for those who should be writing letters for them. I also will offer an opportunity if it's a situation where I need to respectfully decline the student asking me to write a letter. I help them brainstorm. I don't just leave them out in the cold and say, good luck, find somebody else. That's not very helpful to them. But I do ask them, who are your mentors? What positive rotation experiences have you had? What rotations where you've had experiences that really align with your career goals and where you really flourished, and those preceptors, what is that relationship like? What could they do in potentially offering up some letter writing opportunities? And then sometimes it could even go back to an employer. What do their supervisors look like? What is the correct individual from the academic space to be able to be asking for a letter? Also, just having a relationship potentially with an advisor, but not really doing any projects with that particular faculty member may not, again, be helpful and really tell the full story of who you are and the talent that you have. And so I really try to lift them up and help them understand that we need someone to help you tell your story and has that experience of working with them in a variety of different situations.
Couldn't agree more, really. It's really getting it across that, a letter of recommendation isn't something like a wink or a, hey, 2 thumbs up. It's going to put objective things down of interactions and action. And if you don't have a relationship involving those actions, whether organizational, service, classroom, so on and so forth, it's not in one's best interest. It's almost like a parenting thing. So it's
Yes. And I think sometimes we have fear of hurting someone's feelings. Like we don't ever want to turn down a student, regardless of what your situation is. And I think, but the student deserves the honesty in a really authentic way. And then you can help them figure out who is the best letter writers. And for you to be able to provide that expertise and some of that experience, you don't have to leave them hanging. So I think we're able to give them a gift in that way and hopefully be able to have a better letter for them out of it.
It's making lemonade out of lemons, letter of recommendation scenario. So a nice warm transfer. Stephanie, that I really appreciate that answer and that dialogue there. I'm going to jump over to a bigger picture thing for all of us here. We'll start with you first this time, but in the big picture, can you share a success story regarding dealing with a difficult learner?
Yeah, I actually have one that comes to mind more in this recent year. We were having some challenges for a particular student being successful in their APPE rotations. And I think what we have to remember is we're all human. And this particular human, the student human, was having a hard time in life. And we have to recognize that we are all human and really embrace those things that are really blocking us from succeeding in our learning journey, especially, in our our PharmD curriculums and really helping these students show up to be their best selves. So I think sometimes it's quick for us to judge as preceptors, or even those of us involved in academia, that if someone's not studying hard enough, or, there's all these didactic problems or whatever it might be. But at the end of the day, everyone has a story, and their story might be incredibly challenging. And how can we reach that student at a different level and really talk about what might be going on that might be impacting their ability to retain information, and impacting them, their ability to, application of knowledge. And so typically there's an underlying story and there's an underlying challenge. And I really like to get to the root of that with our students. I will say this particular student is actually thriving right now. It was a tough summer, but has made some really, really positive choices for themselves, and ways to be self-aware and continue working on their growth and development. And in turn, it's been a positive relationship with the college too, as we've seen this person grow and develop, and hopefully graduating here soon.
Well, everyone can always appreciate a positive situation. So thank you for that. It's, no other area than in precepting do we get to interact with student pharmacists. And I really appreciate what Stephanie was saying there of student humans. Hearing someone else say it actually stopped me in my tracks, and I say it all the time. We're humans first. We're also adults and professionals, right? But everyone truly does have a story, as Stephanie articulated. And, we're not all privy to it until we are. And really processing that and thinking it through is big time important for everyone. In my role in our School of Pharmacy for Director of Experiential Learning, when I walked in with two things: a couple letters to put above my door, think paint, but not, that just say never give up, and then a box of tissues. I can't tell you how many times my computer hasn't worked, but I have always had those two working for me. So it's incredibly important. All right. So Meagan, back to you. Can you share a success story regarding dealing with a difficult learner for us here today?
I would love to share an instance where I had a difficult situation with a learner that turned into success. So I do think that as Stephanie just mentioned, and as you talked about, one of the things that we need to recognize about our students and residents is that they are human too, and that's really important. And so one of the things that comes to mind, one of the instances that comes to mind, is dealing with a resident who, similar to Stephanie's situation, just had a lot of life going on. And I think it was really hard for this person to be vulnerable with us about it because of just the way that the resident learned and operated. There was a real separation for them between personal life and work life. And as we know, those things bleed over, and there's sometimes a lot of gray between what we do outside of work versus what we do when we're here. And so the separation just kind of became harder and harder to navigate. And without wanting to ask too many personal questions for fear of them not wanting to open up, I found it was just easier to do it anyway and see what comes up. And so one day, I have a 45-minute drive from my clinic to my clinic from the School of Pharmacy. So we spend a lot of time in the car talking about a lot of random things. But this particular time, we didn't have any student learners with us. So we were able to have a conversation that was just more personal. And I mentioned, again, starting with an I statement, that I noticed that they were seemingly just not as present, or it just kind of felt like they may have been struggling with something, and I asked if they wanted to share more about it. And at that point, I got a lot more than I bargained for, but it really did help me to have insight into what was going on the personal side that could be affecting their performance in clinics and different rotations. Upon learning that, I did ask if it was safe to share without sharing too many of the personal details, but sharing some of that back with the director of the program at the time, just to make sure that they were aware of some of the things that could potentially, afford the resident accommodations, so that they were not feeling like they were stretching themselves just being present every day. And so what I learned from this situation was that us showing vulnerability helps our learners show vulnerability as well. And that way, I think I have taken forward not only in experiential learning, but also in the classroom. And, just really trying to emphasize vulnerability in different ways. And so if you guys are familiar with the social location introduction, it's an opportunity to really share a little bit more about what shapes you as a human being and your past experiences and how you show up in the world and how that forms your opinions and thoughts. And so I do that now in my classroom where I actually did it yesterday. I taught my students about racism as a public health crisis in our population and rural health course. And I started that with sharing my social location because I think it's important to understand how that's influenced the way that I see things and why there are certain things that are important to me as it relates to my professional career as a Black woman. So let's not be afraid as preceptors to be vulnerable. I think there are certainly professional lines that should exist, but I think that showing our learners that we're human too and being vulnerable helps them to also be vulnerable and better navigate situations like the one I described.
All right. So pivoting a little bit again, there's a lot going on in society overall, but particularly within healthcare professions and especially in pharmacy, there's this lost element of progress and what's involved with progress and success. So, Stephanie, can you give us a few thoughts here on failing forward?
Yeah, this kind of comes after our discussion here with difficult learners and talking about the success story with difficult learners. I think sometimes a failure can be a success for students, and failure can really be a gift for students. And we can provide the structure and support for that in some of those difficult situations. Sometimes the best thing we can do for a student is to be able to provide that expectation, that structure, working with those learners, and provide sometimes a safe place to fail. I think we can all say that we do strive for that for students who are still in their learning journey before graduation, or even in potentially even a residency situation. Anytime we're in that learner environment, failure can bring so much opportunity for us to see what's on the other side, for us to be able to be more clear about what it is that we're trying to achieve to move forward. So I want to empower preceptors to not think of failure necessarily as this negative connotation. No one likes to fail our students. No one likes to go there. No one likes to have those conversations. But sometimes it could be absolutely necessary. And I think we should use it as a tool, what it's deserved to be, and not necessarily put it in a negative light.
Amen. It's, not to be a campfire conversation, but part of success is failure. It doesn't absolutely always happen, but it's an integral part. That's for sure.
Thanks, Mark. And I think we have to help teach that. I think sometimes it's challenging for learners and sometimes generation to generation to be able to learn the art of failing.
Thank you very much. That is some actionable, dynamic thoughts there. And I love that you're pulling from, actual multiple instances for you there. And that's really what we're here for today is, really to provide this conversation overall for our listeners, of what's going on with an APHA with precepting. So I really want to thank you all for your time here today. And I think we could end on kind of paraphrasing and taking an excerpt here from actually our APHA EVP and CEO, the amazing Dr. Michael Hogue. He always ends his messages with, "For every pharmacist, for all of pharmacy." Here today, let's add in, "and especially for preceptors." So folks, I really want to thank you for your time here today. There's a lot that goes into precepting, and it is certainly a two-way street. But as always, I just want to wish you a great day every day.